Viltepso is a medication used to treat Duchenne muscular dystrophy, DMD, a genetic muscle disorder caused by the lack of a specific muscle protein called dystrophin. Viltepso works by increasing the amount of dystrophin in the body, helping to improve muscle function. It is administered as an intravenous solution, and the daily dosage and optimal timing should be determined by a healthcare professional. This medication is administered through a vein by a healthcare professional according to your doctor's instructions. It is typically administered once a week for 60 minutes. The dosage is determined by your weight. If your condition does not improve or worsens, inform your doctor immediately. Some common side effects of Viltepso include pain, bruising or redness at the injection site, abdominal pain, diarrhea, vomiting, or joint pain. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as signs of kidney problems, signs of infection, shortness of breath, or unusual tiredness. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms like rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not mentioned, be sure to contact your doctor or pharmacist for guidance. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Viltepso, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney problems. If you are planning to have surgery, make sure to let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if it is clearly needed. It's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that Viltepso may interact with other medications, which could affect how they work or increase the risk of serious side effects. This is why it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to inform lab personnel and your doctors that you are taking Viltepso, as it may interfere with certain lab tests and cause false results. Always consult with your doctor before making any changes to your medication routine. If someone has taken too much Viltepso and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center for assistance. Before starting Viltepso, make sure to undergo necessary lab and medical tests, such as kidney function, to ensure it is safe for you. It is important to keep all medical and lab appointments while using this medication. Make sure to consult your doctor for more details on this. Make sure to take Viltepso as directed by your doctor. If you happen to miss a dose, contact your doctor or pharmacist immediately to determine the best course of action. It is crucial to stick to the prescribed dosing schedule for this medication. This medication, Viltepso, is administered as an intravenous solution in a clinic setting and is not intended to be stored at home. It is used for the treatment of Duchenne muscular dystrophy in patients who have a confirmed mutation of the DMD gene that is amenable to exon 53 skipping. The recommended dosage is based on the patient's weight and is administered once weekly. The optimal timing for the administration of Viltepso should be determined by a healthcare professional. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.